From NBC News, this is Today.
This morning on Take It Off Today, dropping half your body weight. Actor Ron Lester had a good career playing the fat guy. You might remember him as Billy Bob in Varsity Blues or the funny fat guy in Not Another Teen Movie and the TV series Popular. But at more than 500 pounds, his health situation wasn't funny at all. So he set about to change that, losing 315 pounds. Ron's remarkable weight loss story, 508 pounds to wow, is featured in this week's People magazine. Let's take one more look at Ron before he lost the weight. That's Ron. And now, Ron Lester, let's see the new you. This is the new Ron. Can we get a wide shot, guys? Ron is actually 2 inches shorter, right? You lost weight on the top of your head, the bottom of your feet, face 8 inches narrower. He's had 43 pounds of skin removed from his body. Ron, good morning to you.
Morning, Meredith.
I want to also introduce your girlfriend, triathlete Kate Williman, and Dr. John Morton, the Director of Bariatric Surgery at the Stanford University School of Medicine. Once again, good morning to you all.
Good to be here.
All right, Ron, you lost how much weight? 300 some?
Technically about 315 pounds.
Down to from 508 pounds to 193 pounds. Yep. This was in December of 2000, and you had the gastric bypass surgery. I'm sorry.
Right.
What? Everybody has a moment where they say, "I just can't live my life like this anymore." What was it for you that made you decide, "I've got to radically change"?
There was several moments adding up to it, to the event. One of the biggest moments that really turned my life around was we were doing a scene on a show called Popular on the WB, and there was a scene where I had to sit as a driver in the limousine, and I couldn't fit behind the steering wheel, so they had to take the seat out for me to get into the car. And even with that, I still couldn't fit behind the wheel. And Michael Robbins, who was the producer and director of the show, was directing this one episode, and I just remember I broke down in tears.
Yeah.
And I lost it. And then within a couple weeks later, I'm at home watching TV, and I see they do a thing on the television about Carnie Wilson, and I was like, that's it.
Who would have the gastric bypass?
Yeah.
And Dr. Morton, Ron had this gastric bypass, and it obviously worked for him. But it may not work for everybody. What should people know in terms of that surgery?
Well, first of all, I want to congratulate Ron on taking that step forward, because it takes a lot of courage to come forward and do something about your health. And this is a serious operation, but desperate times call for desperate measures. In a lot of ways, surgery is kind of the first responder to this public health epidemic. We have potentially 12 million patients who may benefit from this surgery. And in short, the patients who benefit are those with a BMI, body mass index, over 40, or a body mass index over 35. And with those patients in mind, they can get tremendous benefit.
And that was somebody like Ron. Thank you, Kate. Dr. Morton, thanks very much. Be right back.